For example, we look outside today, it's a great day, it's sunny.
Yes.
It's tempting to just sit outside in the sun, but of course, before laser, it's not a good idea.
Yes.
You're able to treat skin, you're able to treat acne scars, you're able to treat vascular issues, you're able to treat pigmentation, and you're just able to use it just for pre-treating, for rejuvenating the skin, for just giving the skin a bit of a boost. So
In the market.
it's the most advanced all-in-one platform on the market. It's also the fastest and the smartest, and it's the safest.
Selamat pagi pada para profesor dan dokter di seluruh Indonesia hari ini di Bali dalam rangka acara First Pan Asia Conference of Dermatology bertepatan dengan PIT Perdoski ke-20 2025. Saya di sini bersama seorang bintang tamu kita, Dr. Tino Solomon, yang sangat banyak pengalamannya akan membahas mengenai salah satu laser dari perusahaan Alma yang di Indonesia akan dibawakan oleh PT Radian Elok Distriversa. Good morning, Dr. Tino.
Hello.
Very nice to have you here exclusively in Indonesia for talking about Alma Laser. Would you please introduce yourself, Dr. Tino?
Hello Indonesia, apa kabar? I am Dr. Tino Solomon, and I am based in London, the United Kingdom, and I'm very pleased to be here in Indonesia.
Today, I would like to talk about something new, like a game changer maybe. First, I would like to introduce myself. I am Dr. Rita Maria, a dermatologist from Indonesia. And here with me is Dr. Tino Solomon. He is a plastic surgeon with maybe more than 20 years experience, doctor?
Correct, yeah.
Especially in aesthetic and especially with laser, exclusively Alma Laser. Okay, thank you. First, I would like to thank to Radian Elok Distriversa company as our officially distributor of Alma Laser in Indonesia for giving me the opportunity today to do podcast with Dr. Tino. Good morning, Dr. Tino.
Good morning.
Would you like please introduce a little bit
Of course, yeah.
of yourself?
So, thank you. I'm very pleased to be here in Bali. Very pleased to be here with the team, and it's a delight to be here in beautiful Bali. I always like coming back here. So my background is I'm actually a general surgeon. I trained as a general surgeon in London, UCL, University College London, back in 2005. So it is exactly 20 years. This is the 20-year anniversary of my graduation. And I trained as a general surgeon after that, and then specialized in aesthetic medicine and aesthetic surgery. And we've been practicing in London since for almost 10 years now, in the aesthetics field, where it was a fledgling field. It was a very sort of new field of medicine. Initially, it wasn't taken very seriously, but we brought together many specialties. We brought together dermatologists, surgeons, plastic surgeons, general surgeons, GPs, family doctors, all together to create essentially a new field of medicine that encompassed dermatology, encompassed surgery, encompassed general medicine, and encompassed the sort of beautification of medicine as well. So we are treating, and we continue to treat, conventional conditions, and we continue to treat aesthetic conditions as well. So it's a marrying of the two. So I became very interested in that in my career, in my surgical days, that I thought that let us not only treat pathology, let's also treat the well-being. And the well-being not just psychologically, the well-being physically. And we continue to grow and grow, just as we see globally, as you see in Indonesia here, the growth of the aesthetic industry, the growth of aesthetic medicine and aesthetic surgery. And I'm very excited to be in the center of it. And this is why we're here today, because we're going to talk about the new technologies, we're going to talk about the new avenues that we're exploring.
Yeah, thank you, Dr. Tino. We are very honored you come here exclusively to maybe we have launched the Alma Laser, Alma Harmony in Indonesia, because before Dr. Tino mentioned that Alma Harmony has been developed for 2 years maybe and launched here also in Indonesia.
Yeah.
And actually, 2 days ago, Dr. Tino shared a lot of his experience using Alma Laser. Like Dr. Tino said that also in Indonesia, we all dermatologists, surgeon, and GP also do the aesthetic field, so we can create many innovations for helping our patients.
Yeah.
Okay.
So yeah, I see aesthetics is a reflection of the devices, or the devices are a reflection of the aesthetics industry, where you bring together multiple uses, multiple technologies, multiple approaches, and combine it in a sort of an all-in-one. And aesthetics reflects that in the sense that for the first time, really, you have a medical specialty where you're not just one specialist. You can be a dermatologist, and you can be a surgeon, you can be a GP, and you can be equally as specialized and with your own specialist expertise. So you can be, for example, a dermatologist who specializes in treating acne and acne scars, but you also broadly treat aesthetic conditions and you aesthetically beautify. That's part of your role. Whereas you can also be a GP and your specialty might be hair restoration, or you can be a surgeon where your specialty might be scar remodulation. So it's a very holistic field, and it's a very all-encompassing field. And the devices that we're talking about today, the Harmony, sort of reflects that. It's a device that brings together wavelengths and handles and technologies all in one platform that you're able to treat hair, you're able to treat skin, you're able to treat acne scars, you're able to treat vascular issues, you're able to treat pigmentation. And you're just able to use it just for pre-treating, for rejuvenating the skin, for just giving the skin a bit of a boost. So I thought that was quite interesting to sort of see how it is, like I said, a reflection of the aesthetic world, the aesthetic specialty as well.
Okay, I do agree, doctor, because now we are talking not only about science, about knowledge, but also about technology, because good technology will help us improving the condition in our patient. And today we will point out to Alma Harmony.
Of course.
Maybe first I would like to ask, actually I asked Dr. Tino before that Dr. Tino not only have a lot of experience in Alma Harmony, but also the other products from Alma Laser. And maybe if we have time, we will discuss a little bit about nicely, beautifully Alma Hybrid also, that we have also in our hospital. But maybe for the first, we will discuss about Alma Harmony. Dr. Tino, I would like to ask, what is the platform you like maybe most in Alma products? What platform you like?
So the platform, I can tell you, I like all of them. That's the honest truth.
Yes,
I like using
know,
all of them.
Yeah.
We used all of them. In fact, we have the entire Alma range in our clinics. We have 3 clinics in London, and we're a very busy clinic. In fact, we're possibly the busiest clinic, aesthetic clinic in the UK. Seeing thousands of cases a year between the three clinics. We have 5 doctors and we have 20 therapists. In terms of our use, predominantly we use the Harmony, simply based on numbers. In terms of my role and what I do most with the lasers is between the Hybrid and the Harmony.
Okay.
But of course, we have therapists treating with the Prime X, and we have therapists, of course, the Soprano. The Soprano is it's originally designed for hair removal. It's a hair removal device, a very safe all-in-one hair removal device, but it's now being used for lifting as well. So we're using it for that sort of non-invasive, non-surgical facelift, which is becoming more and more popular in Asia. So I predominantly use the Hybrid and the Harmony.
Okay.
And maybe skewed more towards towards more the Hybrid. But the Harmony is the most used, most frequently used, and the most popular in the clinic, and the most popular with patients as well.
Yeah, I see. I also know the reason. Maybe my next question, what makes Alma Harmony predominantly used by you? Maybe because of the multi-platform?
Absolutely, yeah. So it's a good question. The Harmony is the most popular, and you'll find it's the most popular in most clinics that have it as part of their arsenal of machines and technologies. You have in one platform a multi-handle, multi-wavelength device that offers you the ability to treat ablatively and non-ablatively conditions as simple as just rejuvenating the skin that might look a bit dull, to advanced pathology of the skin. So you can treat, with that Harmony, you can treat skin dullness, skin pigmentation, non-ablatively. You can treat acne non-ablatively. You can treat vascular lesions, for example, thread veins, rosacea, angiomas, anything that involves sort of vascular pigmentation or textural issues. And of course, we have an ablative component to the Harmony as well, where you can treat scars, you can treat skin that perhaps you want to resurface. You can treat atrophic scars, hypertrophic scars. And there is now some reports and some studies coming out to using the ablative and non-ablative technologies in the Harmony to treat hair loss. But this is sort of really advanced, developing studies that hopefully we'll be talking about in the future. So what you have available to you is an all-in-one that you rarely need to leave that platform to finish off your treatment. Occasionally we leave the platform just to finish off with a biological, and I'll talk about that later, how we combine technology with the biological as well.
So, Dr. Tino just said that why Alma Harmony different from other platform in the market?
It's the most advanced all-in-one platform on the market. It's also the fastest and the smartest, and it's the safest. It's been rigorously tested. It was redeveloped from a technology that dates back to 2003. So the original Harmony actually goes back to 2003. So it's an evolution of a technology, but rather than just being upgraded, think of the modern aircraft where they're developing new aircraft, and rather than just changing a couple of engines and upgrading the interiors, they take that design, they know what's safe, they know what works, and they redesign it up using the understanding, the lessons learned. So the Harmony is essentially a newly developed machine learned from previous devices, previous Harmony devices, from the technologies that work, improved those technologies, and reconstructed it in an all-in-one platform. So essentially it gives you a very fast, safe, smart, all-in-one at your fingertips in your clinic.
Like your presentation yesterday, you said that stronger, faster, smarter, and safest.
Yeah, absolutely. And that's what we say. And all of those have evidence to back it up. We don't just say that based on our own experience. We've got studies to show that it is faster in treating certain conditions, it's safer, and it's also very flexible. So not only do you have the smart technology involved for beginner users or for users perhaps who just want to be safe, but you can manually override that for more advanced users as well.
Yeah, okay. And like Dr. Tino said that the company developed the Alma Harmony and then they add another handpiece each generation, like we will discuss next about the handpiece. Like maybe yesterday Dr. Tino mentioned about BioBoost.
Yes.
Yeah. So would you please explain to our audience the greatness of Alma Harmony?
So the BioBoost is a concept. BioBoost is a concept that was developed to harness the power of the Harmony. So the concept of BioBoost is that you're performing a treatment to biomodulate, to bioboost your skin and your deeper tissues. And biomodulation is essentially where you're stimulating, at its very core, you're stimulating fibroblasts to produce collagen and to produce elastin. So you're essentially rejuvenating the skin, not only from the surface, but you're rejuvenating the deeper tissues to essentially turn back the years, to make the skin in a better shape, to create this better appearance of the skin. And how you're doing that with BioBoost is you're using the technologies, non-ablatives. A BioBoost is all about non-ablative, no downtime, combining 2, 3, 4, even up to 5 wavelengths. I always talk about wavelengths, but when I talk about wavelengths, I'm actually referring to the handles, because each handle has a wavelength in it.
Yes.
So perhaps we might use the erbium glass. In this case, it's the 1540. We might then combine 1064, the Nd:YAG Q switch, so that's a shorter pulse, and then also the long pulse. We might then combine a non-ablative erbium YAG. We might then combine IPL. So BioBoost is a combination, it's a concept where you combine technologies and wavelengths to biomodulate the skin with no downtime, minimal to no pain, and a relatively fast and, for the patient, also cost-effective treatment. So it's a concept that you can take and create your own BioBoost. It's not fixed.
Yes, it is very nice because we know that all of our patients mostly want a quick result, but with no or minimal downtime.
Absolutely,
and with Alma Harmony, it will help us very more with a lot of patients, especially at your clinics, maybe, Dr. Tino?
I like to talk more about the technology and the concept of BioBoost, but actually think about it from a marketing point of view. So you can take that BioBoost and you can market it as a treatment, as a bio-boosting treatment.
Yes.
So just as people say, come in and get your Botox, botulism toxin, come in and get your PLLA modulation, come in and get your hyaluronic acid filler. You can then say to a patient, it's time for your next BioBoost, rather than saying, it's time for your next IPL, it's time for your
Yeah.
next clear skin. It makes more sense to the patient to understand what they're achieving, what the end point is.
Yeah.
And that's what the patient wants to know. What am I achieving with this? I want to treat my wrinkles, so I'm going to get botulinum toxin. I want to bio-boost, so I'm going to get the bio-boost.
Yeah, it is very nice. Also, I agree with Dr. Tino that from the marketing strategy, relabeling the name of the treatment is very useful in Indonesia because it is like a very unique modality that a device or a clinic have. So they can offer a treatment that has great impact on the patient, especially if we talk about Alma Harmony.
Absolutely,
Okay.
and it's become very popular. It's proved to be very popular in that sense as well.
Yeah, okay. And talking about Alma Harmony, we know that in one machine, in Alma Harmony, we have 11 technologies. Now, would you please mention about, maybe we continue into the handpiece, Doctor?
Yeah, sure. I'll talk about the handpieces we have. In fact, there are 135 FDA-approved indications for the Harmony. That's an increase from 65 and more being approved as we speak. So the previous Harmony, the last generation Harmony, which is only a few years ago, had 65 FDA approved. So FDA approval is a American regulatory step that takes quite a lot of proving. You have to prove a technology and a treatment is safe, and you have to prove that it's effective, and you have to prove that you're able to repeat it.
Yeah.
So that's FDA approval. It takes a lot of work, it takes a lot of regulatory inspection. So we have 135 indications. Doesn't mean there are 135 handles. There are actually a few handles. I'll talk about some of them. But there are lots of permutations, lots of combinations.
Okay.
So you can combine 2, 3, 4,
Yeah.
and all of those you can combine between each other and all together or individually. So that leads to many, many permutations, many combinations, and 135 of those are FDA approved. It doesn't mean you can't perform other ones.
Okay.
So for example, what are the technologies? We have the erbium glass, otherwise known as the ClearSkin Pro. The ClearSkin Pro is a non-ablative erbium glass treatment, 1540 wavelength. You have Clear Lift, which is the 1064 Q switch, just above the threshold for pico laser. It's a nanosecond laser. So it's a Q switch 1064 treating predominantly pigmentation, but also rejuvenation laser. You have the IPL handles, and you've got several of them. Broad spectrum for the 400 nanometer ranges, all the way up to the 700s.
Yeah.
So you have a broadband IPL, which of course you can then focus on narrow bands in some of the handles. You have a new handle, the Iris Acne, which focuses on the lower range. So you can treat the acne at the blue light range as well. You then have the ablative laser. You've got the erbium YAG, which is, again, a redevelopment of the previous iPixel. It's now called Superb, and that's a 2940 wavelength, nanometer wavelength, and that's the ablative. That's the only ablative laser that we have in there. And going back to the 1064, you've of course got the 1064 pigmentation, you've got the spot, and you've got the pixel.
Yeah.
So with the spot, you also have the 532 KTP, which you can treat tattoos with, and you've got the pixel, which you can treat pigmentation and also tattoos with. In addition to that, you have an infrared handle, which is often used as a sort of skin Cinderella effect, a glow effect. We usually use it before events or perhaps at the end of other treatments. And so that covers your non-ablative and your ablative. And of course, you have the vascular laser, which is one of my favorites. You've got the Clear Vas, as it's called, which encompasses long pulse 1064. And that involves a long pulse of the 1064 wavelength as opposed to the Q switch. And you use that usually in a spot mode to treat individual vessels, to treat very, very mild thread veins, also to treat rosacea, for example. With that, you have a new mode called quasi-long pulse. And quasi-long pulse is somewhere between the Q switch and the long pulse. Long pulse is microseconds, and the Q switch is nanoseconds. So you have milliseconds in between. And those milliseconds, the milliseconds is a long pulse, the microseconds is a quasi-long pulse. And that gives you a different dynamic for treating blood vessels as well, vascularity. So you have ablative, non-ablative to treat vessels, pigmentation, acne, acne scars, and of course your standard sort of glow skin Cinderella effect.
Okay. I had Dr. Tino mention about the vascular pain.
Yes. So I'm glad you mentioned that. So in addition to those, you have a new device.
Vascular pain, the new, that not used in latest generation before.
Absolutely correct. So as part of the redevelopment of the Harmony, I said it was developed from the ground up, Alma decided to add a new handpiece with a wavelength we might be familiar with. It's a 532 wavelength. So 532, you'll see it in the IPL ranges. And you'll see it in the KTP as well. But the way it's delivered is delivered with a fiber laser, a diode laser. And the purpose of that, so 532 nanometers penetrates just a superficial layer of the skin. So it's predominantly designed to treat vascularity in the superficial layers. We also find it's very useful because of its superficial penetration and because of its focused beam to treat skin lesions, skin tags, warts, hemangiomas. And the way it works is that it coagulates. It's absorbed into the hemoglobin at that wavelength, hemoglobin and melanin absorption, and you can treat very superficial vascular lesions or superficial lesions which have a lot of water in them. But anything that has hemoglobin in it will absorb that and will coagulate. So we've been using it for the most superficial thread veins or vascular lesions and also the most superficial skin lesions in combination with other treatments. It's permanently connected to the machine, so you can always finish off a treatment with it as well.
Yeah. Actually, one interesting that Vascupain is safe for all skin type, doctor, because
Absolutely.
of the diode?
Yeah, so it's a diode laser, so it's much safer than, for example, using an IPL at that wavelength. And it's very safe. It doesn't generate heat like the IPLs do, and it's very safe to use in all skin types. Of course, we're always careful when we do treat vascular lesions, particularly with the power you're using, but a diode laser is significantly safer. And in fact, in London, because we have a population with types 1 all the way to type 6 skin, we have had the advantage of being able to use it on all skin types and prove that it's safe in all skin types as well.
Yeah, because we are very happy to have the new Vascupain in Alma. Okay.
Of course, yeah.
Maybe, doctor, when we buy the laser, we may not buy all of the handpiece. Now, I would like to ask, for you, what are must-have handpieces you will choose for Alma Harmony?
Absolutely, it's a very good question. Often a clinic has a budget, and the budget would be limiting your ability to go for the full works, the full range. Of course, it's something you can build up, so you're not committed to all the handles in the beginning, but you can slowly build up as we did. You build up your offerings by building up the handles that you will add to your Harmony and therefore what treatments you're able to offer. I would say, as a very minimum, depending on what you do in clinic, I would make sure I'm covering ablative and non-ablative.
Yeah.
So I would want, at the very minimum, a Q switch. I would like the clear lift. I would like the clear skin because it offers me the ability to treat the skin to rejuvenate,
Yes.
to treat scars and to treat acne,
Yes.
because it's non-ablative erbium glass. And I would probably choose the erbium YAG, which is a ablative laser. So I can then treat, my patients can come in with skin lesions. My patients can come in with acne scars. I can treat all of that. And you can also use it as a resurfacing laser just for rejuvenation. The Vascupen would be a nice addition to use because it's permanently permanently attached to the machine. So by having the clear skin, 1540 erbium glass, by having the clear lift Q switch, by having the erbium YAG ablative, and perhaps by having the Vascupen as a little bonus, you cover between 70 to 80% of what you would be treating. Now, if you're a clinic that predominantly offers vascular treatments or see a lot of rosacea patients, as some clinics do, then I'd probably add an IPL for that. But it depends, the true answer depends on your clinic. But I'm giving what we would like to do, what we would use in our clinic. And if I were to start off with 2 or 3 handles, that's what I would choose.
Yeah, I do agree with Dr. Tino. So minimal, we have 3 handpieces,
Yes.
right, doctor? And I think like nowadays, especially in Indonesia, we have quite a lot of problems in vascular. So maybe we should have this Vascupain
Absolutely.
in Indonesia.
And you have to look at your clinic's
Yes.
caseload and what you see, what you've seen historically, what you expect to see in the future, what your patients ask for. And you'll know from your patients, you'll know from your experience. And then base your treatments, base your purchases, and base what you'd like to do on your patients' desires and what they request.
Okay, I think very clear that minimal we have 3 handpiece. Yeah. Maybe next time if we have money, we can add another handpiece.
You can always add a handpiece.
Yes.
In fact, we have currently we have 2. We have 3 of the Harmony XL Pros, the previous one. We have 2 of the new Harmonies, the latest Harmony devices. And with the latest Harmony devices, we're still adding handles.
Yeah.
So we're still at this stage adding handles.
Okay, I think
building a lot.
yeah, it is very clear about the handpiece of Alma Harmony. And maybe next we will talk about the cases, doctor.
Of course, yeah.
Actually, yesterday I know a lot of experience from Dr. Tino, but maybe Dr. Tino would like to share with our audience what cases that you treat with Alma Harmony and the combination. I know your recipe
Of course, yeah.
for your last presentation, very nice.
So the way we treat it on the basis of a bioboost. Everything we consider bioboost except ablation, because ablation technically is not bioboosting, because bioboosting, the concept should come under non-ablation. So, for example, we will say you're coming in for a bioboost to treat your acne. So with the acne, we will, as we showed yesterday in our demonstration, we'll treat with the erbium glass, 1540 nanometers, that's the Clear Skin Pro. We will treat the entire face with the pixel head, and then we will then spot treat individual acne lesions. Usually when you have active acne, you'll find that there's some acne scarring from previous acne. So we will use the Clear Skin to also treat that acne scarring. We will then go on and treat with the Clear Lift. So this is the combination treatment. The Clear Lift is your Q-switch 1064. Why? Because the 1064 is very good at deeper stimulation, biostimulation. So you want to create that bulk heating and also that bulk stimulation in the deeper dermis, because 1064 penetrates a bit deeper. And then usually after that, depending on the skin type, I might finish off with an IPL. To reduce the erythema, to also treat any vascularity in the skin that might be as a result of acne. Or I might treat, for example, with the infrared, because infrared is very, very good for overall skin tightening, just to sort of plump up the skin. If I were then to combine it with ablative, I would then use the erbium YAG for the scars, but at this stage I wouldn't. With pigmentation, I would focus on the Q-switch. The Q-switch 1064 in its pixelated form and in its spot form. The spot form is just a different tip, and I would target the pigmentation with that. But remember, the Q-switch, when you're treating pigmentation, you have the advantage of also biostimulating. So you have the biostimulation. And I'd usually add probably a Clear Skin. Depending on the skin type, lighter skin types, you can then add another IPL, because the IPL, of course, will offer you that melanin absorption. So you'll be able to treat redness and melanin in that. Darker skin, you have to be very, very careful with that. In cases of vascular lesions, usually, again, I like to always start with a Clear Skin Pro because I like to biostimulate. I would usually skip the Q-switch. I would then move on to the long pulse. I start with the long pulse, and I work on the deeper vessels. And that long pulse you can use in the quasi-long pulse mode, where you spray the face with the long pulse laser, and then you can target individual deep vessels. So that's the long pulse 1064. I would then go in with a IPL, the IPL to treat that mid layer as everything comes to the surface, and I'd finish off with the Vascupen as a superficial. So think of it in layers. You have at your disposal 3 vascular lasers to treat different layers of the skin, different layers where the vessels lay. And like I said, I usually put in the mix Clear Skin just for that biomodulation. Again, that's a bioboost. You're treating a bioboost. Acne scars, rejuvenation, I like to mix. This is not bioboost because it doesn't fall under that category, but it is still bioboosting. I'd like to mix the Clear Skin, Clear Lift, so Clear Skin 1540, Clear Lift 1064, and iPixel Superb, which is the ablative 2940 nanometers, because that gives you that nice resurfacing effect. It's one of my favorites. Resurfacing is incredible if the patient's willing to have the downtime. Whether that be around the eyes, you can do limited areas, or you can do full face. And that's how we normally combine them. So, and of course, the endless combinations that you can devise. You can create your own combinations. And of course, what we normally do is we combine that then with the biologicals. So we're very big on using the energy and then using the biologicals afterwards.
Yeah, it is very nice because like Dr. Tino said, that we treat one case with a few handpieces, so we will get faster result, safer, and I think patient is very satisfied with the result.
It's faster because it's more powerful in synergy, using different handles, different wavelengths, but it's also safer because you don't need to be as aggressive with each wavelength, so you don't risk entering the complication zone. The complication zone is a zone where any treatment, if it's strong enough, will cause a complication. Whether that be excessive redness, it might be pigmentation, it could be hypertrophic scarring, it could be hyperpigmentation. So that's why we think the synergy is safer by adding more handles, especially if you're targeting one particular condition.
I agree, because we know that if we too much be careful, we will not get the result. But if we are too brave, we will get serious complication. But with this Alma technology, it will make the good nice result, but make the patient safer
Sure.
and minimal complication, right?
Yeah, so
doctor?
see the Alma as a device that gives you the power of synergy, the safe power of synergy.
Yes, because we know that most of laser in the market, in one machine, maybe they just have 1 or 2 or 3,
Absolutely. It's in fact the highest rated all-in-one platform in terms of FDA-approved indications. Nothing comes close to that in terms of number of indications, FDA-approved indications. And of course, like I mentioned at the beginning, you can create your own combination. So it's endless. The more handles you add, mathematically, the more permutations you have as well.
We can combine the handpiece wisely, appropriately for our patient.
Absolutely.
Very nice, doctor.
Okay.
So we still keep learning and improving, like you said before.
Developing, improving, and essentially developing your own protocols as well.
And of course, we work together with technology.
Yes, and we share our experiences as well. That's the key with aesthetics and with all of medicine.
That's why make the laser, maybe people say expensive, but they do not know about the development, the cost of the science behind the laser.
The return of investment is much greater, significantly greater. Like I said, you have a device that will serve you for years and it will serve tens of thousands of patients. If you utilize it to its maximum capabilities and maximal potential, you'll not look back.
Of course, because and also Alma laser is strong enough. It means that when you use in a quite long time, it is still safe and actual, especially if we do good maintenance for the result, the laser.
Absolutely, yeah.
Okay. Now, maybe next we talk about the patient satisfaction, doctor, in your clinics. What their opinion after doing your combination, your recipe, like that?
Of course, yeah. A good question. Going back to exactly why we use the Harmony, patients want to save money. They want safe treatment. They want treatment that's effective, and they want to save money. So if you told the patient, okay, I'm not going to guarantee that you'll have a result, I'm not sure it's safe, but it's going to cost you a lot of money, they'll walk out the door. And you'll never see them again, or they'll have one treatment and they'll never come back. What you want is a effective, safe treatment that's cost effective as well. And the Harmony, because of the no consumable aspect of it, remember that's a very important point. There are no consumables to the Harmony. Yes, of course, any machine needs occasional servicing, but you don't have any disposables. There are no consumables. Because there are no consumables, once you have the handles, once you have the device, essentially it's just repeated use. You have that repeated use capability of it, and you have it, again, we talked about the combination treatment using the synergy, so lower power on each of these handles, and because of that lower power, it's safer, and you get treatments, the end point of the treatments, the results, quicker. So the patient has fewer sessions, you have fewer sessions.
So fewer sessions, that is important. So cost effective.
Cost effective for you as well, for the doctor, for the therapist, and for the nurse. So you have fewer sessions in clinic, less clinic time for you, and less sessions and less spending for the patient. But of course, you will see more patients in that time as well.
More patient. That is the point.
Exactly.
At the end, Okay, doctor. So for the Alma Harmony, I think our new Alma Harmony will be nice trends in 2025.
I think it'll be very interesting to see how it's used here in Indonesia, the sort of, novel uses, the combinations that perhaps we don't even do in the UK. Again, you'll be treating different skin types here. And I think here the innovation of Indonesia to use a platform, I've seen it myself. You'll probably come up with some interesting protocols that I'll be very interested to have a look at and possibly borrow those protocols myself to use as well.
Because it is new in Indonesia. Even the Radian Elok company not yet mentioned about the price because they just launched. I think our doctor will be excited to get this Alma Harmony as part of clinic service.
Absolutely, as part of the clinic services. It's been a very, very useful and very effective contribution to our addition and contribution to our clinic's offerings as well.
Maybe, doctor, is there anything else should we mention again about Alma Harmony? After this, we will talk about some cases, maybe.
Of course, So what I mentioned with the Harmony, I generally combine energy with biologicals. So we're very keen to use the Harmony to combine it with biologicals. And it was not mentioning any other brands. I like to use the power of biostimulation biologically with injectables, again, not mentioning any brands, so but the hyaluronic acid, PLLA, for example, ingredients in combination with energy. And I find that very powerful. And I encourage anyone who's performing energy treatments to also do the same. Don't just limit yourself to the energy. Use the power of energy to also combine with the power of the biologicals.
Yeah. Okay.
Right.
Okay. Maybe we will continue to some question. I would like to ask Dr. Tino, because we know that most of Dr. Tino patient is white skin,
Yes.
different with Indonesia, darker skin. So maybe Dr. Tino can share some tips for us, for Indonesian doctors,
Of course.
for using Alma Harmony because we have darker skin.
So actually in London, if you're perhaps aware or not aware, we have a wide range of skin types in London. London is a very multicultural, multi-ethnic population. And we have type 1 skin, a lot of type 1 skin, but we also have a lot of type 3, 4, 5, and 6 skin.
Yeah.
A significant proportion of our patients are actually all the way from type 4 to type 6. I would say up to 50% of our patients.
50%.
So we do have experience treating it. Yes, we have a lot of experience treating type 1, type 2, type 3 skin, but we have a lot of experience treating type 4 to type 6. So what suggestions and advice might I give to for the sake of the patients in Indonesia where you have type 4, type 5 skin as well? Use the power of combination. Again, going back to the core of why is the harmony so powerful. Power of combination offers you to treat safely at lower powers.
Lower power, yes.
But combining them, you get that synergy and you get that same endpoint.
Yeah.
In fact, I'd say you get an enhanced endpoint because it's not just about power. It's about attacking a particular condition or a particular skin type or particular pathology that you might be treating with from different angles, different wavelengths. So power of synergy, lower power. Also, I would always advise you prepare your patient beforehand.
Yes.
Always make sure that the patient's prepared for the sake of hyperpigmentation, which is the greatest, obviously, the greatest complication that you might be familiar with and also be afraid of. And you should never be afraid of that. But preparation and aftercare is key.
Yes,
and that comes from the biological preparation and the behavioral preparation. For example, we look outside today, it's a great day, it's sunny.
Yes.
It's tempting to just sit outside in the sun, but of course, before laser, it's not a good idea.
Yes.
Making sure that the medication that the patient's on also doesn't interfere with the laser. So for example, tetracyclines, isotretinoins. Just be very aware that your patient might not be in the right condition at the moment to be having laser, but you can facilitate that. You can arrange and engineer that so that they're ready for laser, and you can deliver the laser very, very safely. I'm of the great belief that all wavelengths are safe in all skin types, provided you do it in the right method, in the right format.
Yeah, I do agree, doctor. So we have to adjust the parameter, make it lower for darker skin, and combination.
Combination is the key. Combination is at the core of what the harmony is.
It's the core of Alma Harmony.
Absolutely.
And then like before you said, I do agree, pre-treatment, priming we say, in priming, and post-treatment care, because the result will be depend of that all factors. Jadi, so not only the laser. Okay.
Absolutely. Biologicals and energy.
Yes,
together.
yes, okay. And then when you use Alma Harmony, I would like to ask about maybe a little bit side effects or complication you observe?
So complications with the Alma Harmony, they're very rare. And the
very
extremely rare because it's safety built into the machine, safety built into the parameters. It's a smart machine, so you have presets there. You'd have to manually override those presets. Think about the modern aircraft again, the analogy of the aircraft. You have autopilot. It's very hard for a pilot to override those autopilots. You have to really go out of your way to do so. And when you set settings manually, you generally only do so when you know what you're doing.
Yes.
So it'd be very unusual to set something on the machine, not knowing what you're doing, to potentially lead to a very severe complication. But of course, with the ablative and with the IPLs, ablative being the erbium YAG, with the IPLs, there's some cases in the past where we've had very mild hyperpigmentation. We've had sometimes excessive erythema, excessive redness. But that's about it. That's all we've had. Both of which are very treatable. Predictable and reversible, importantly.
Yes, predictable and reversible.
Reversible, yeah. So most of these side effects, I would like to say more adverse effects rather than
complication. Not complication, but
they're mostly reversible and preventable as well. But I wouldn't worry too much about them. I said, know your parameters and understand the machine, understand that the machine has your back essentially. It's safety built in.
Yeah, I do agree, doctor. And then maybe next, how about combination with other modalities like other device you have?
Yeah.
And the interval maybe?
Yeah, so
Share,
you're probably
Dr.
aware
Tino?
that we have the Alma hybrid.
Yeah, next we still have time. We will discuss a little bit about Alma
So
hybrid.
we're big users of the Alma hybrid. The Alma hybrid is a CO2 hybrid laser. It's CO2 and erbium glass
Yes.
In a hybrid format. So we combine that predominantly with the Harmony to treat scars. So often we use the erbium YAG and the clear skin, and then we combine the hybrid on top of that to resurface the skin. We also use the Harmony after hybrid, not just before. So before hybrid and acne scars, we use it also after the hybrid when we're treating certain conditions with the hybrid. We use the IPL to reduce the redness.
Yes.
So it's a very nice combination of a 1-2, where you do the non-ablative treatments with the Harmony, the ablative treatments with the hybrid, or you do ablative on both of them. The CO2 is not offered on the Harmony because the CO2 is a completely different beast altogether.
Yeah.
But the CO2 and the hybrid and the Harmony combined together is a very, very powerful combination.
Yeah, I agree. It means that we can play with the laser, so we can use the handpiece, the wavelength to increase the result and to minimize the complication.
Absolutely, and you use the power of synergy again with that. And CO2 offers something different. So CO2 in combination with all the wavelengths of the Harmony covers your entire laser spectrum. That's pretty much every wavelength that you would need, with the exception of the low band wavelengths, which are like the infrared lights, which are low level lasers. They're not technically true lasers. But other than that, you're covering all the wavelengths with the Harmony, and then just add the CO2 on the hybrid. That covers you all the way from 420 nanometers all the way up to 10,600 nanometers, which is the CO2. So
very happy if we have both two lasers in our clinic.
Absolutely.
It's make you have a lot of experience. I'm very honored to hear your experience.
I encourage everyone to try that, that combination and try using your own protocols, developing your own protocols, because the power of combination, like I said, it's very effective and it's very safe.
Yeah, in our clinic we have Alma hybrid. Maybe next we will suggest our doctor to get Alma Harmony into the clinic.
To add it to the mix.
We would be excited and we will keep contact with you, of course.
Yes, of course.
And I forgot to ask about stretch mark, doctor.
Okay, very good question. So stretch marks are one of the most difficult conditions to treat. It's we call it one of the holy grails of aesthetic medicine because they haven't cracked it yet. So when we eventually do, but we're getting there. So we know what causes stretch marks. We know that there's a significant loss in collagen and elastin, particularly elastin, in the stretch marks. I mean, lots of studies done, particularly in the US, and taking skin biopsies, looking at it, special scanning methods to look deep into the stretch mark. They are considered scars, actually. They're stretch scars. And because of that loss of collagen and elastin, our endpoint should be to stimulate that collagen and elastin significantly. So I do encourage biological stimulation, but also you want some sort of ablation. You want ablation in that. And the ablation will come from the erbium YAG on the Harmony and CO2 with the hybrid. The erbium YAG and the CO2 can be used in combination again, which is what we do, or one or the other, just to create that ablation, to create that resurfacing, and also to stimulate that deeper tissue. So you can, of course, combine it also with the deeper stimulation, non-ablatively, the erbium glass, the 1064.
It's mean that in one session, or you...
In one session,
in one session,
yeah. So everything I talk about here is usually one session. Repeat it.
Which one first?
So normally you would go for you'd start with the biological, you would then go for the non-ablative, and then you would ablate at the end. Most of our treatments are a combination, starting non-ablatively and finishing non-ablatively, or you add the ablative. If you add the ablative, you would go with the erbium YAG and or the CO2. And the biologicals and stretch marks are very important. So I'm talking PLLA, polynucleotides. They've been proven to improve the appearance.
We mention it as LADG.
Yes, absolutely. Laser-assisted delivery of drugs, or laser-assisted delivery of ingredients, LAD. And you're using those laser channels, if you're ablating, to deliver those products through the skin. Also, there is a type of stretch mark, the rubra stretch mark, which is the red stretch mark.
Yes.
Very notoriously very difficult to treat. And the IPLs are very useful for that. But of course, you have to be very careful with the IPLs.
Yes, the IPL, we should be very careful.
Be very, very careful. But that's also what I would add to the mix with the red type of stretch marks. Don't expect significant changes, but expect improvement. You will see improvement. And that's already a significant markup from previous technologies where we didn't see anything.
Yeah.
And even now, creams are being sold, technology is being sold, they do nothing. The patients are just wasting their time and money.
Yes, wasting time, money.
Yeah.
Also, okay. And for keloid?
Good question. Again, keloids are very, again, notoriously difficult to treat. Keloids are usually a genetic hypertrophic reaction to an injury. So you form excessive cross-linked collagen, excessive, we call it messy collagen under the skin. So the collagen is in an irregular pattern, and as a result of that, it doesn't heal in the standard manner, and then it forms essentially a growth, a tumor on the skin. And what we want to aim to do is shrink that. We want to destroy the collagen in this case. So how do we destroy it? So you can use the lasers with the Harmony, the ablative lasers, in this case ablation only, and you can use the ablation in the CO2, predominantly CO2, to either punch holes through the keloid and then deliver products through those holes. We talked about it, laser-assisted delivery. And the products we use would be, for example, 5-fluorouracil and steroid.
Yes.
Or you can use the laser to cut the keloid and then treat the base of the keloid. So you can excise the keloid. In this case, you probably have to do it with CO2. Absolutely, and we excise it with the CO2 and then deliver the products under the keloid to stop it regrowing, because keloids notoriously come back. So either you shrink the keloid with the ablative lasers or you cut the keloid with the ablative lasers, but in both cases, you're using ingredients to deliver it to the base of where the keloid is or where it's growing from, to try and inhibit growth and to try and shrink the growth of the keloid.
Yeah, very nice. We can do
so
it.
So ablative, and again, biological with ablative laser.
Yes.
And you have that available to you with the Harmony and with the hybrid.
Yeah, combination. Dr. Tino had both of the laser.
Of course, and we use it every day.
Okay. Maybe we still have time, Dr. Tino. Maybe if I forget something, is there anything else we should point out about Alma Harmony?
I think with the Harmonies, the emphasis I make when I introduce it, I train on it, I show people its uses, is to, again, I want to emphasize the power of combination. Often, yesterday I was being asked, that can I have this, I just want to treat acne, I want to use the clear skin, 1540. I say, don't just use the clear skin, use the power of combining handles and combining wavelengths. So I want to emphasize that point. Combine. Make sure you're combining non-ablative on its own or ablative and non-ablative, because that combination, again, will get you to your endpoint quicker and it will be much safer, and you'll be much more comfortable using that in that method, because again, you're utilizing the power of the platform. As we said, smarter, faster, stronger. And it would be a shame to have a machine like that and not utilize it to its capability. So that's one of the points I want to make. The second point I want to make is don't be afraid to combine biologicals with energy. So remember, when you're treating any condition, there's always a role for biological, whether that be skincare, whether that be injectable, before and after using the energy, in this case, the Harmony or the hybrid.
So the point is combination. And the second is working together with biological.
Combination as well. Combination of energy.
Combination. So the key is combination.
Absolutely.
That is the unique of Alma Harmony.
Absolutely.
So I encourage our doctor in Indonesia to have Alma Harmony as part of our clinics.
Absolutely.
Okay. Maybe we still have about 10 minutes. We talk a little bit about Alma Hybrid also. We have it in Indonesia, doctor. What you like, the unique about Alma Hybrid?
So the hybrid is our workhorse in our clinic for the doctors. We are not only an acne clinic, but we're also a scar clinic. So we treat a lot of atrophic acne scars. We treat hypertrophic surgical scars, burns. We treat a lot of keloids. So the hybrid, again, it's a combination technology. It harnesses the power of CO2, 10,600 nanometers, and it has a erbium glass, 1570. So very similar to the erbium glass on the Harmony. And that power of the combination is that it gives you the ability to offer CO2 on its own for resurfacing, for cutting, surgical applications. You have the erbium glass for remodeling, biomodulation, bioboosting on its own, non-ablatively, and you have, more importantly, and this is the real reason for the development of the hybrid, is that combination of ablative and non-ablative. And we know from studies that that's safer because you have ablative, non-ablative side by side, so you have less downtime, but it's also more effective in treating scars and rejuvenation. You have the ability, and no other machine does this with the hybrid, where you can combine side by side in different ratios and on top of each other. So you have ablative in a ratio of 1 to 1, 1 to 2, 2 to 1, 3 to 1, 1 to 3 of the CO2 and the non-CO2 side by side. So you can pick and mix how you want to treat it depending on the skin condition, depending on the condition you're treating as well. And you can also go very aggressively, you can go very mildly. Like I said, you can go very aggressively where you can treat it on top of one laser on top of each other. So you can do the CO2 to create that ablation and the non-CO2, the 1570, the erbium glass, to coagulate and to cause that thermal ablation deeper inside. So thermal coagulation deeper inside. So that gives you the most aggressive resurfacing type treatment.
And the two wavelength will be come out from one shot.
Absolutely, yeah. So it's one port, it's a mirrored system. It's a fiber laser again, so it's a mirrored system, and the laser will be emitted from that same port.
Yeah, so it is why I call hybrid, maybe.
Yeah, it's a true hybrid. It's not a hybrid with two handles, it's a true hybrid.
Yes, true hybrid. Yeah.
With the hybrid, you also have a third handle, which is often not talked about, but I'd always like to mention it, and that's the impact, the ultrasonic device. Yeah.
The impact, we will mention after this.
Absolutely, you have two lasers in one handle, and then you have a second handle.
Yes.
So one handle for the lasers with two lasers, and a second handle with an ultrasonic delivery. And that offers you low-level ultrasound, so low-frequency ultrasound that helps you deliver. We talked about transepidermal delivery. Yeah. So topicals, you place on the skin, even PRP that's generated from the CO2. When you're bleeding, you generate autologous PRP. You can push that through the skin with the impact device. And we use that almost exclusively.
Yeah, it's mean that our beautician can use impact by themselves.
Absolutely. So how can they do that? They don't have to use the CO2. You can use the impact after microneedling.
Yeah.
So you create a channel where that channel is created from microneedles or created from CO2 laser, or even the iPixel. The iPixel being a bit more superficial.
After CO2 laser, and then we do the impact.
So let's say you have your erbium YAG, or you have your CO2. I called it iPixel, it's now called Superb, or you have your CO2 with a hybrid. You create channels, superficial or deep. You then use your impact to push products through those channels. And we know from studies, we know from our experience, but also from skin biopsy studies, that the products can get down very deep, up to 4 millimeters, in fact. So that's quite significant, and that offers you delivery, very precise delivery of drugs and ingredients into the skin.
Sorry, doctor, I remember one important question. I'll back to Alma Harmony. I will ask about the clear lift depth. They have, we can adjust, right?
Yes.
The focal depth?
Yes, absolutely. So going back to the clear lift, so this was the Alma Harmony. This is the Q-switch 1064. So I always like to talk about the wavelength. So clear lift is Q-switch 1064. You have now, because you have motorized heads on the Harmony with all of them, with the spot treatment and with the pixel, you can adjust the depth. And that depth can offer you faster treatment of all levels of the skin that you're treating pigmentation at, or rejuvenation, instead of having to change the tips as well. So you have at your disposal a very quick way to change depth, as well as changing
without changing the tip.
Without changing the tip. And equally, when you have the spot tip, you can change the size of the spots with all of them. You can change with the ablative and the non-ablative handles, you can change the size of the spot. But with the clear lift specifically, because pigmentation lies at different depths.
Yes, pigmentation, it is very important.
And the Q-switch is really important to get those pigmentation bands. You can change it at basically at the touch of a screen. You've got the smart software. So it took us yesterday maybe 1 or 2 seconds just to change every time we moved on from one depth to another.
Okay, yeah. Okay. It is very important because in Indonesia, maybe one of biggest problem is pigmentation.
Absolutely, yeah. Pigmentation.
Melasma. Very naughty to be treated.
Remember, you can also pre-treat melasma with the Q-switch. So if you don't see melasma, it might be brewing under the surface, or hyperpigmentation might be brewing. So you can treat after you do, for example, other treatments, or before you do other treatments to prevent that pigmentation from coming up. You break it up before it becomes an issue as well. Yeah. So yes, variable depth without having to change the tips.
Yeah, nice. Okay, go back again. We still have a little time to discuss about Alma Hybrid. What cases you like to treat most with Alma Hybrid?
So we treat a lot of acne scars. I love treating
acne scars.
It's predominantly scars. However, I can tell you what we do treat. My favorite being acne scars and hypertrophic scars. I do like those because they respond so well.
Yeah.
But we do treat acne scars of all types, very severe to the very mild, limited to large areas. We treat hypertrophic scars from surgery. We treat atrophic scars from surgery. We pre-treat scars as well. So you can treat scars before they become scars. So if you know somebody's having surgery, you can pre-treat an area with the hybrid to trigger an inflammatory response, to trigger a healing response before they actually have the surgery. And we know from split studies where they've treated one side pre-treated and they haven't treated the other side, then they have the surgery. They compare. Yeah, the pre-treated side, the scar is much visually more cosmetically acceptable.
Okay.
And of course, what else do we treat? We treat skin rejuvenation. So aging skin, so skin that's damaged from the sun, skin that's damaged from aging. We treat it with the CO2 hybrid as well. And more recently, we've just started to treat hair. And that's something for another discussion, a topic for another discussion, as we're currently conducting our own cases, where we are very mildly ablating the scalp to create a very mild wound response. And that wound that we've generated as well, we're delivering products through the skin as we normally do with the hair, we inject using the impact. For
yes, I try some cases for hair loss with Alma Hybrid. I do laser CO2 and then I do the impact. I put the like exosomes, like
PRP, polynucleotides are all been shown to help regeneration of hair. You have those channels, but you also have the wound response as well. And the wound response recruits stem cells. And those stem cells are very regenerative for the hair as well. So acne scars, hypertrophic scars, keloid scars, surgical scars, and hair loss. And of course, rejuvenation. It's a very good rejuvenating laser.
I try Alma Hybrid for rejuvenation. I like it, especially for periorbital area.
Yeah, absolutely.
Yeah, very
it's
nice.
Very good around the eyes as well.
Less downtime.
Yeah,
especially if we add like cream for post-treatment care. I use like the CO2 and the 1570.
Yeah.
And then after that, 2 or 3 days disappear the redness.
Yeah, absolutely.
Very nice.
Yeah, so you have the advantage.
Minimal, less downtime.
And you've got the impact device we can deliver those
yes.
well.
I use also myself for neck.
Yeah.
Very nice.
And in fact, the Harmony is very good for the neck because you have that power of combination. We like to use the clear skin, the 1540, combined with the erbium YAG, so ablative and non-ablative.
Yes. So the patient happy, the doctor is happier because we do the laser on ourselves, each other.
Of course, we are ambassadors to our patients, so we have to practice what we preach.
Yeah, and we should have a nice performance. It means that we can do the same to our patient. Agree, doctor?
Absolutely.
Okay, I think our time is up, doctor. Thank you very much for your thoughtful sharings, experience. Please keep contact. Maybe Radian Elok, our company, will often invite you to share experience in Indonesia. And I will not miss the chance to meet you.
Absolutely.
Thank you so much.
I'll be more than happy to come back anytime. I'm very glad to be here, and thank you for the invite, and thank you for speaking with me today as well.
I think this is not your first time, right?
No, I've been here many times before.
You like Indonesia?
I love Indonesia.
You
I love
like
Bali.
food?
I like the food, I like the people, and I like the atmosphere here.
Oh, thank you so much.
And I hope to come back many times in the future.
Yeah, we are very happy. Okay, we tell Radian Elok.
Absolutely.
Okay, thank you, doctor.
Thank you very much.
Thank you very much. Okay, thank you very much. We have to finish our podcast today, and hopefully you all have a nice and great day, especially in Bali. See you.
Beautiful Bali.